Hi everyone, this is Samantha Minns from the Nutritional Genomics Institute, and it is February. So naturally we are talking all about our hearts this month, and we can't really have a discussion on cardiovascular health without mentioning cholesterol and lipoproteins. So if you look at the word lipoprotein, it's literally fat and protein. And what these molecules do is they transport fat and cholesterol throughout our bodies within our blood. More than likely, you've heard of HDL or our high density lipoproteins, as these are often called our good cholesterol. And then we also have our LDL, which is our low density lipoproteins or our bad cholesterol. LDL has gotten a really bad rap, and this is due to the fact that LDL particles transport cholesterol into our arteries. And if not controlled, this cholesterol can then accumulate, form plaques, and increase our risk of an adverse cardiac event. So by conventional testing standards, a low level of LDL is desirable, as it likely indicates a person has a decreased risk of developing heart disease. However, from a functional precision medicine standpoint, we like to take it a step further and take a look at an individual's particle size. So a patient may have a low level of LDL, but if their particles are very small and very dense, they're still going to be at an increased risk for developing cardiovascular disease because these small dense particles are much more likely to stick together and still form those plaques that are going to increase the risk of an adverse cardiac event. So when we're looking at particle testing and particle size, what we really want to see is nice, big, fluffy particles, as these are much less likely to stick together and form those plaques within the blood vessels. In terms of additional testing, we also like to look at the level of inflammation in the body, as inflammation is both a cause and a result of cardiovascular disease. So we might look at hsCRP, which is our high sensitivity C-reactive protein. This is often elevated in the early stages of the inflammatory cascade. We may also look at MPO or myeloperoxidase, and this reading can give us a good idea of the level of inflammation that's within the arterial walls. And of course, looping in nutrigenomics, because that's what we do at NGI, we take a look at several different genes in our cardiovascular panel, one of those being LPA. So LPA actually increases the uptake of LDL particles into the blood vessels, and at the same time inhibits the enzymes that are designed to dissolve clots. So this gene is a really significant marker of cardiovascular risk, as it can be somewhat of a double whammy in terms of our blood vessel health. Last but not least, interventions. So we take a look at an individual's genomics and their metabolomics, and we may recommend several different interventions, including supplements like niacin, lysine, carnitine, vitamin C, maybe even some fish oil. And from a diet standpoint, we may recommend a lower saturated fat diet, as we do not want to overload our particles or our lipoproteins if they're not able to transport fat efficiently throughout our bodies. So if you have any questions about genetic testing, about inflammatory testing, about particle testing, about our cardiovascular panel, please feel free to reach out to me or any of the other NGI team members. We would love to discuss this in detail with you. We're wishing you a very happy February and very happy hearts.